infectious diseases, earthquakes and flooding, armed conflicts. Every year, millions of people in WHO's European region face threats to their health, but they are more than just affected communities. Their behavior and solutions hold the key to minimizing disaster impact. WHO's flagship SocialNet training empowers emergency responders to communicate risks and understand and engage the communities they serve. This is SocialNet.
SocialNet 2019 is happening in Belgrade, Serbia, and it's the second training of this kind in the European region.
Traditionally, outbreak response has been very driven by epidemiology, which of course is an absolutely critical tool in understanding who is affected, who is not affected, why are they not affected. But what that doesn't give you is an understanding of people's perceptions and their understandings of the disease and of the response.
Statistical data doesn't always provide the understanding of what is happening within the community, what are the community dynamics, the power dynamics and relations within the community, and also what makes people behave in a certain way.
In order to achieve the best, to achieve our maximum, we definitely need to engage affected community and all our communities in our activities.
One of their accountability to really make sure that they embed this social sciences and reaching out to the communities, understanding communities, and the community engagement as a whole as part of the responses, preparedness, or whatever they do.
Never say never. And because of that, we have to be prepared for good operations.
We have over 50 experts. We have public health experts, epidemiologists, communication, health promotion, emergency. They're really coming together to understand each other's needs and to really work to engage the communities in the response.
It's designed to present knowledge at a basic level to people who may or may not have had any exposure to it in terms of key concepts, social science, risk communication, behavior change, and community engagement.
This is the real thing that connects all of the response together. The logistics, the managers, the commanders, and the social ones.
The structure of giving some people some classroom experience with lots of hands-on activities so they get gist, but also get experience playing around with that concept in a really concrete way, followed by a deployment where they get the taste of how do these apply and how are these relevant in an emergency setting, is just a wonderful, like that 1-2 punch.
As I worked in real emergencies, I can say that this training is as close to real emergencies as it can be.
The teamwork is essential. I think that the best job is done is collaborating with others.
The reality is that there will always be another emergency. If they are able to go out into the field and conduct community engagement, work with their communities, that's wonderful. If they just understand how important it is and know that they need to include this as part of their incident management system and get experts to come in and work on this area, that's a huge benefit for our world as well.